The envoys appeared overwhelmed by the number of refugees there, which prompted Jori Kebilungi, the commandant of the Kyangwali refugee resettlement camp in Kikuube district, formerly part of Hoima, to explain. She revealed that the increased population was occasioned by an influx of refugees from the Democratic Republic of Congo, increasing the pressure on the already available scarce resources.
The numbers have increased from 35,700 to 791 to 92,430. What does this mean in terms of the resources that are available? We are faced up with a very serious challenge in several sectors.
Kebilungi called for solutions to address the pressure now being reflected in the stretched health and education facilities, among others.
That means we must improve, we must make a revolution of how we are doing things. We are looking at the issues of livelihood. Before, this land was enough to support in terms of livelihood, whereby people had big chunks of land to dig. But I'm beginning to think that we must revise the way of how this available land is to be utilized. When we thought about horizontal, I think this time we have to look at the vertical part of it.
It's time to prepare for maybe a new influx, to see what has to happen. Land will become less because the land will have to be divided among more refugees. So maybe a solution is to learn new skills.
The ambassadors heard that the Kyangwali Health Center 3 was now taking over a population of over 50,000 people rather than the 10,000 expected when the center was set up during the 80s. They also heard that the facility was regularly treating patients at the rate of 70 nationals to 30 refugees at a ratio of 70 to 30.
The other gap that we have is about the ambulance services, the referral services. We have an ambulance on station, but is as well assigned other responsibilities in the settlement, and at times by the time the ambulance is called and it comes to pick a referral to Hoima Regional Hospital, it is a bit late.
In recognizing the numbers of people that have to come to this health centre, I think they need much more resources to help them continue to do the great work they're doing.
The area authorities are advocating for an upgrade to a health center 4 or a district hospital so it can receive better funding.
We can have blood supply, we can have other things like staffing, and also the PHC funds increased.
Refugees living in Uganda are estimated to be above 1 million, something that is of a concern to the Ugandan government, which has increased pressure on utilities and land between nationals and refugees. Juma Kiria, NTV, Kyangwali.